for a child that develops a cold or there are concerns about the flu at that time of year in the winter time, the symptoms of the cold and the flu are oftentimes overlap, and sometimes they're a little bit hard to distinguish between them. So runny nose, cough, congestion, fever, those are all things that are very commonly seen with a common cold. The flu tends to hit you a little bit harder, a little bit faster. So generally speaking, we see kids who develop a sudden onset of fairly good fever along with a bad cough. So fever and cough are the two most common things that we see that would indicate the possibility of the flu. So then the question is, when do you need to see somebody for a cold or the flu? So the cold and the flu are both caused by viral infections. And so there are not, antibiotics don't work for colds. There is an antiviral medication that is used for children with the flu, but there are only certain segments of the population that are even considered high risk who really need to be on a flu medication to try to prevent complications. So what I'm looking for kids who get brought in for a cold or the flu, or if parents have questions about it, has to do with the complications associated with it. About 30 to 40% of all kids who have colds or the flu do go on to develop a complication that needs to be treated, usually treated with an antibiotic. So the most common complications associated with colds and flus are ear infections, pneumonia, and throat infections. So the symptoms of those are generally going to be fairly reliably recognized by parents, which is most colds and the flu generally don't give you a fever over 101 for more than 3 or 4 days in a row. If you get past that 4th day of running a fever over 101, I'm going to be suspicious that there's a complication that needs to be treated. For the runny noses that you get with infections, they're usually all sorts of fantastic colors, yellow and green and you know, that kind of stuff. If we have thickened, discolored nasal discharge, that is normally associated with a cold or the flu. It generally is not considered a problem unless you've had it for a certain number of days. I go with the Academy recommendations, which is about 10 days of what looks like just gross green and yellow stuff pouring out of your face. That's the point at which I would become worried about a sinus infection. Symptoms of a cough can last for 2 or 3 weeks when it comes to a cold or the flu. And so up until then, it can be all part of the same illness. Once you get past about 3 straight weeks of coughing, then we do need to start thinking about other reasons for that cough to continue on, potentially treatable causes.